I do what I do every day because I care about the patients, but it's a gift to be recognized by my peers and my coworkers as something extra to know that people do notice and that it's great to be recognized. But even if I wasn't, my passion is my patients. So either way, it's great.
Sometimes you just go into work and you got those who are not doing so well, and they just need to put a smile on their face. And I love to crack little jokes, make people laugh, ease the tension. Most of the caregrams I get, all the people say thank you. It's typically because I'm pretty good at easing people's attention.
I will always give my 100% to any patient that I have, coworkers, always willing to do hard work and continue to care is the reason why I'm in nursing.
My love language is service. In this particular case with COVID, I volunteered my time as an interpreter to ensure that the communities who weren't English speaking understood how important COVID was, how dangerous it was, what the correct steps were, how to get immediate health care assistance, things like that.
I couldn't believe it. I didn't even know I got nominated. I like to take care of people, and it means a lot to me.
I don't feel like I did anything special. I feel like everyone on my unit deserves a Daisy Award. It's a great honor.
I was nominated by some of my coworkers and some of the staff nurses, so to me that means that they feel like I'm doing a good job, and that's the most important thing to me, is to make them proud of what I'm doing.
As a manager, it's when I feel like I'm doing everything wrong and I get that text message or I get that email that says, I just want to let you know that I appreciated that you did this, or thank you. I think leadership in general, it's hard for them to take that recognition for themselves. I think that's why you go into leadership, because you want your team to get that.
We try to figure out, what we can do to better our care for our patients. And this past year I did one called Back to Basics. I love teaching. I have a passion for that as well. My fellow nurses, I love seeing them. Love when the light comes on and we're like, this is gonna make my job better. I'm gonna be better at what I do. And so, that was where this award stemmed from.
It was a crowning moment in my career of 37 years, almost 38 years. I received that because I had two ideas to help kind of make patients' lives better.
My nomination actually came from the patient's family, and that was extremely satisfying for me, and in the fact that it solidified that yes, I'm making a difference in my patient's life in each and every day, but I'm also making a difference in the families' lives.
I was honestly very surprised that I got it. I didn't expect to receive the award, so I was a little overwhelmed and shocked, but very thankful, and it just made me feel like I was where I was supposed to be and doing what I was supposed to be doing.
I was so just taken back by it. I feel complete from it, that I'm giving back to the new staff and to our current staff when they need resources. I understand how they feel. I've been in those shoes before, and for them to respect me and feel that I support them makes me feel really good about it.
I've been a nurse for 14 years and always worked to be I'm very proactive and very conscientious of being a nurse. My responsibility to my patients, to my employers, to those around me, to my associates, I don't take that lightly. Every day I'm prayerful to really just be the best that I can be. And so getting that award was totally surprising and just a blessing. It really shocked me, but I'm very humbled by that. I work with a lot of amazing nurses. I work with a lot of staff that are not nurse-based that would be equally deserving of this award. So I'm thankful.
If there's something that I don't know, I strive to figure out, what it is. If a certain diagnosis that a patient has is something I've never heard of, I try to research it and talk to the physicians and see everything I can to best care for the patient that way.
I do what I do because it's the right thing to do. I have no right as the charge nurse and post-op to ask somebody to do something if they don't see me doing it first. I was kind of taken aback because I was like, doesn't everybody do this? I just assumed that this is what you do. But the acknowledgement was wonderful, and I appreciate it. I think it's made me a better person and made me believe more in myself.